You are good to go.
Great, thanks. Hi, everybody. Welcome to Board of Health for the month of September. We are going to make some changes to our agenda today. Just as a reminder before we get into that, though, that the meeting is being recorded and live streamed. The changes I'm going to ask for from the group is to move up some of the actions that require voting, because I have to leave the meeting a little bit early. So to make sure that we can get those done before I have to hop off. So we do not have anyone from the public here yet. If somebody does end up coming, we'll invite them in to go ahead and have that discussion. So let's go ahead and take care of the approval of the minutes from August. So can I get a motion on that? Okay, I have a first from Melissa. And from Ed. Any discussion on that or changes that are needed? Okay, all in favor? Let's do raised hands. I think that's unanimous. Any opposed, just in case I missed, or any abstentions? Okay. I'm going to go ahead and move forward to the environmental health administrative action from Liz.
Christina, the problem we have is that we think the person coming for privilege of the floor wants to speak about that action item.
Okay, so then let's go ahead and tackle the financial summary while we wait and see if they're coming. So Brenda, is she here?
I am.
Oh,
the financial summary was, it's okay. The financial summary was included in your packet. I really don't have an update to anything that I put in the report.
Okay. Any questions for Brenda? Okay, great.
So one option would be we could start the discussion on that item and maybe hold a vote to allow the person's comment if he joins.
Well, we have some time, so why don't we go ahead and just keep going and just see if anybody, and if we start to get closer to when I have to hop off, then we'll switch up, but that's a great suggestion. So Frank, why don't we go ahead and have you talk a bit about the administrative report?
Sorry.
You're muted.
We would still have a quorum without you, Christina. Just a couple quick things. First thing, we're going to need a nominating committee this year. Janet Morgan is her term is ending on December 31st. I did reach out to Janet to see if she was interested in seeking reappointment, and I think she's decided that the time has come to let somebody else fill the role. We will need a nominating committee. So if usually we're looking for 3 folks that are interested in doing that. If anyone wants to jump up right now, please do. If not, we'll be reaching out to try to get 3 folks. We'll do some, we'll put a press release out saying we're looking for some applicants and begin that process. But we will look for folks. Janet, I don't know if you wanted to say a few words.
Well, I was just going to say my seat has been one of the at-large positions. So really, I guess candidates could come from anywhere in the county.
Yep. Yep. Great.
I was just going to ask, it's not specific to like nursing or anything or healthcare.
No, the position that Ravinder is in is the City of Ithaca position. So that one is very specific. It requires the mayor's approval. All of the other positions are essentially at large, except that we are required to have 3 physicians on the board. So we have the 3 physicians with Doctors Dundali, Capel, and Evelyn. So Janet's position would be a truly at-large, anyone 18 or older and a county resident could serve. Okay, so sorry, moving on.
Wait, Frank, does anyone want to jump up right now and offer to be on the nominating committee? So Shauna offered. I'm happy to help too, Frank.
Okay.
Do we have one more? And Melissa's happy to help as well. Okay,
Right, and Christina, Mr. Voorhees just joined.
okay, great. Frank, is that the end of your report or did you have?
It is not, but if you want to pause there and
Okay.
move on back to privilege of the floor.
Okay. So Derek, Mr. Voorhees, can you come to the screen? We're going to pause. We had started talking about some other things, but we're going to pause and do privilege of the floor right now. Derek?
Did you see he put a comment in the chat?
He's
Yeah.
muted now.
I think we can hear you. We just can't see you, which is fine.
I don't think we can hear him either, unfortunately.
Derek, are you talking right now? Yeah.
Derek, this is Greg Potter, the IT director. If you can hear me, please disconnect from the meeting and try again.
So Frank, I'm going to have you go ahead and keep
Okay.
talking. If
Sure.
Yeah, while they work on that. Yep, go ahead.
Just wanted to kind of give the monthly COVID update. Since the last time we met, I think everyone's probably aware that we saw a spike in cases related to a cluster with Cornell. That cluster grew to, I think, almost 130 people. I think about 45 or so ended up being positive. The good news is the contact tracing worked. We were able to identify the close contacts, get them into quarantine, and many of the positives that resulted were individuals that were in mandatory quarantine, which is the best case scenario, short of not having cases, and because they were not out exposing others. So that went as well as it could have. You know, I should offer thanks to Cornell Health and the larger Cornell. They played a big role in helping us work with the students, get them into isolation and quarantine, and that really ended up making this as successful as it was. Things have quieted down over the last few weeks on the disease front. We're back to kind of what we were seeing pre-spike, and we're seeing 1 or 2, maybe 3 cases a day. And so I think we're now today at 20 active cases. So that's the good news. Things have kind of stabilized and returned to normal. Cornell is in full swing with their surveillance testing. They're testing between 5,000 and 6,000 people a day. And that continues, and the relationship with them and CMC continues to be strong. One of our biggest issues right now is the K through 12. And Dr. Nandali's been right in the middle of that, trying to help the school districts understand the guidance. DOH guidance right now is not the best. It does require for a student to return to school that they need to meet 3 criteria: a negative test, an evaluation documented by a healthcare provider, and a resolution of symptoms. So all 3 of those have to be met before a student can return to school. That is a stricter set of requirements than the average person in the community has to meet. And so we're hoping that updated guidance from the state is coming, but it has not yet been received. And then the other issue associated with that is the siblings and household members and when they're able to return to school. So we are not going to use that same high standard for them. A negative test will be sufficient. I'm working with Dr. Nandali and Dr. Mead to get some guidance out, hopefully later today, to clarify that for the districts as well. So we're working to try to improve things on the K through 12 front as well. But there's 7 different districts. The guidance from New York State Ed and New York State DOH isn't exactly the same. So we're trying our best to give them as much clarity and support as we can. Those were the main issues I had around COVID that I wanted to let folks know about. Kristen.
Frank, can I just say something about K through 12?
Sure.
So as it stands, the requirement of note has been sort of a nightmare because some providers are writing notes and letting kids go back to school and others aren't. The other thing is I think it's a huge equity issue because it's really people who have access to healthcare or the means to get a note from a doctor can go back to school earlier, whereas the ones that don't will be out of school for 10 days. So if you would like to call Cuomo and Zucker, that would be great because I'm trying to get as many people at this point to do that because they really need to remove that.
Great. That's all that I had, Christina. I think we have Derek on the phone now.
Oh, Derek, are you on the phone? Can we unmute Derek?
Oh, wait, he's trying to join in on the. Yeah, he's there on the phone and trying to log into the.
Hello,
Oh,
yeah.
you got it.
Gotcha.
Awesome.
this is Dr. Evelyn. I'm not in my office, and because of the setup, I don't know, just trust me, I'm on the phone and I can see all of you on my camera, but I don't have a photo.
Okay.
So are you at 4409, Dr. Evelyn?
Yes.
Oh, so never mind. I thought that was Derek. Yeah, so I think we're still without ability to communicate with Mr. Voorhees.
Can Mr. Voorhees try to call in similar to what Dr. Evelyn just did? Greg, are we able to ask him to do that instead of trying to access this way?
Yes, I will send him a chat message right now.
Okay, great. Thank you so much.
Is Skip on the call on this?
No, Skip's not in today. Adriel is on.
Do
For
we
my
have-
support, if you were wondering how I was handling things without support. Yeah, Adriel's filling in today.
No, I was wondering if somebody could call Mr. Voorhees and give him the call-in number in case he can't access this at all.
Sure, yeah, I can give him a quick call.
Okay, thanks, Adriel.
Okay, and so as we continue to work on that, are there any additional questions for Frank before we move on? Yes.
No, just not really a question, more of a comment. I just want to say how, good the system has worked with the Tompkins County Health Department and Cornell Health in terms of managing people in isolation and quarantine. It's been a difficult course, and the numbers have decreased dramatically, as you have mentioned. But the coordination has been very useful, especially with some of the more complicated people that we've had. And I also wanted to appreciate the guidance from Dr. McQueen regarding some of our sickest people too. So, though he's not on this call. But.
Great, thanks. Any other questions or comments? Okay, let's go ahead and move on to Sam.
Hi, everyone. I don't have much to add to my report. We will be sending out a press release later today about drought advisory, and Ithaca City and Cornell have already sent out notices. So that will be going out this afternoon, and you all should receive it as well.
Okay, great. Any questions for Sam?
Did you say drought or trout?
I think she said
Drought with the lack of rain, and there's not.
Yes. Okay.
That
That makes sense.
there's probably trout.
I was going to say, are there trout advisories? I'd like to see what those are.
Well, we've got drought and pestilence. Famine is next. So
that's right.
you're in trouble.
That's right. So the medical director's report we'll just read. I wasn't sure if there was anyone from the health department that had anything to add. It was a pretty extensive, actually a pretty extensive report. So if you didn't have a chance to look at it, would definitely encourage you to do so. Yeah.
Just a quick question about the report, and I don't know if this is something, Frank, you can comment on. Has it been officially changed that 10 days is the quarantine, is the, the isolation period from the start of an illness?
So we've been working with 10 days as the general release, but that's not 100%, right? It depends on the underlying conditions of the individual. If they had a more severe disease, if their symptomology was still severe later in the 10 days, it could get extended. For most people, it ends at 10 days, but for some, based on their situation, it can be extended longer.
Okay. Yeah. I think as of last month's meeting, at that point, New York had just kind of pushed that information forward, and it wasn't in full force yet.
Yeah, it's generally 10 days, and testing is not a component of that. It's symptomology based.
And Christine, I just wanted to add that we are actively working on additional flu promotion, and Dr. Klaypeck, there should be a public service announcement that he recorded that will be on the radio, but we'll also be doing paid advertising going forward. So we're working on that, and hopefully everyone is getting their flu shot.
Great, thanks. I'm actually going to step off, Frank, since we have plenty of folks here and you've got quorum. Dr. Evelyn, would you be able to take over from here moving forward, or someone else? I know he's on the phone. He's probably not.
Do we have somebody who's the backup to you?
Dr.
Backup chair?
Dr. Evelyn.
Oh, Dr. Evelyn. Okay.
Yeah, but he may have had to do something else or got. Can
you hear me?
Yes, we can.
Yes. Okay. I'm sorry. I'm technologically challenged today. So yeah, I can take over for now.
Thanks.
But it might be better if I have no agenda. I have a phone. I have a computer. I have a camera that doesn't work.
Okay. Who is the backup to David Evelyn then? Or Dr. Evelyn then? Who's my next?
There isn't a backup.
Okay. Can I appoint somebody?
You can.
Shauna, would you be comfortable doing it? Thank you.
Others.
I think so. David, you're on as the chair, if you can.
I think she just asked Shauna if she could do it. Did Shauna do that?
Yeah, Ed, I think if you could do it, because I'm really.
Well, Shauna's going to do it. Shauna's going to do it. Yeah.
Okay.
Okay.
Yeah, so I'm happy to do it. Hop in here. So let's see here. Why don't we have we had the approval of the minutes?
Shauna, sorry to interrupt. I am seeing that Derek Borges is on the phone, although I'm not seeing the phone.
Right.
So anyway, if he's available, we might want to do that while that's working.
Yeah, let's do it. Okay, Derek, welcome to the Board of Health. Would you like to have about 2 or 3 minutes to go over your situation? And basically, this is a time for the members of the Board of Health to hear what the situation is. After you have finished, we will continue our conversation, and we will deliberate and come to a conclusion in this meeting. So thank you for joining us, and you have the floor.
Thank you. Can you all hear me?
Yes, we can.
Okay. I just, first and foremost, I want to apologize for the whole issue here. You know, it's been pretty tough, this COVID thing. I went out of work. My wife is the one dealing with everything here at home as far as finances and everything else goes. And it's just been really tough trying to keep up with everything going on around here. Her mother was diagnosed with stage 4 cancer. So we've been doing a lot to take her to her chemotherapy and stuff like that. And actually just recently, last week, she may have uterine cancer. So it's been really tough as far as like getting everything around and having the time and having the finances to do so. And it's just been really tough to make sure everything's paid and get this done and that done with all this, especially with me out of work. So it's been difficult. That's all.
Okay. Well, Derek, we are sorry to hear that. And thank you for coming in this afternoon to talk to us. And sometimes it's good for us to hear the situation. And we will hear and take a look at the sewage permit application fee, the request to waive that. And we will certainly make that deliberation, and you will be notified.
Thank you all for your time. Thank you very much.
Thank you. Take care.
You as well.
Okay. So why don't we move forward to the, let's see here, the financial summary.
We're already past all that. Shauna,
Second.
we're up to the Division of Community Health under reports.
Okay, let's do the Division for Community Health.
And we don't have anybody today. What I can tell you is that yesterday I was able to announce to the staff that we have found Karen Bishop's successor. Her name is Claire Espy. She is currently in the Dominican Republic, the Democratic Republic of Congo, and she has been working in East Africa for the last 10 years on everything from maternal and child health programs to drinking water supply programs. She has an MPH from Columbia University, and she spent 4 years working as a program director at Columbia postgraduate. So we were very fortunate to have multiple high quality candidates, Sam Hilson, as well as some folks from the division participated on the hiring committee. We had 2 rounds of interviews, and then I had a couple of subsequent conversations with Claire about her situation and when she would be able to begin working with us. That is the one challenge. She is still in Africa, so her start date will not be until November 30th. She's finishing up a project there, and we'll be returning to the States when that is completed to join us. So we're excited to have her. We're going to have to wait a couple of months before we get her here with us, but she is excited, and she definitely has a passion for public health. And I think she's going to bring a set of experiences that will be valuable to the organization from her time in Africa, providing public health services in a much different setting to a very different population. So we're excited to have her, and look forward to her joining us at the end of November.
Thank you, Frank. Are there any questions for the Division for Community Health? Okay, I see none. Let's move on to Children with Special Care Needs. I think I saw Deb here.
Yep.
Hi, Deb.
Everyone. Hi. I'm sorry I don't have a report for you. We've had a couple of really busy weeks with the spike in cases. Our nurses were well involved with a lot of the case investigation too, and including our support staff. But we're enjoying this little bit of quiet down time right now, and everybody's trying to get caught up on early intervention and preschool work. In the preschool special ed classes, 2 of them have restarted beginning of September, and things are going well so far.
Great. Thank you, Deb. Are there any questions for Deb? I do not see any hands up. Thanks, Deb. Next is the county attorney's report. And I do not see Jonathan Wood on this call.
Jonathan is out of town this week.
Okay, great. Thanks, Brenda.
You're welcome.
Next is environmental health. Liz Cameron.
I also apologize for not having a report. We were tied up in some of the stuff that Deb was tied up in, that CHS was tied up in. It kind of diverted our resources. We've been working with Sam on the water conservation press release. Prior to that, we were also coordinating with the big three water supplies on the drought condition. We're currently in a moderate drought. And we've set up meetings every 2 weeks with them to discuss concerns and check the status and see where we are. So situation is better than it was in 2016 in terms of some of the changes made to the water system. The city has their full plant up and running, which they did not in 2016. So that helps their situation. And then Cornell if it's needed, it's easier for Cornell to get water from Bolton Point. They have a new interconnection. Kate Walker, a public health sanitarian, she has resigned. Her last day was Saturday, where she worked the rabies clinic for us, which was much appreciated. So we are currently in the process of reviewing applications and adjusting workloads since we are now down another person. We're doing very little regular EH work, mainly in the sewage program. Most of our other work is still directed toward COVID complaints and COVID related inspections at facilities. So I think that's all I have.
Okay, are there any questions from committee members? I actually had one, Liz, as far as phone calls that you're getting for retail providers that have people that are not wearing masks. Are you seeing more or fewer of those?
I'd have to check the exact numbers, but just kind of based on the email flow that I see, I would not say there's been an increase. I don't know if there's been a decrease. I think there actually has been somewhat of a decrease in the number of general complaints in general. I don't know whether for that specific one, I'd have to look into it, but I certainly don't think there's been an increase. Okay. Some of them are repeats.
Okay, great, thank you. And we have the Community Services Board report. Let's see here. I do not see a member from that board here. Frank, would you like to provide us with an update?
Yeah, so one of the main subjects with the Community Service Board, their last meeting was in the budget for 2021. I recommended to the county administrator, and he recommended in his county budget that we close our health home program at the department. That program is a case management program that is a subcontract from Health Homes of New York. It's a DOH-based program, and the county has been subsidizing it since 2013 when it first came into existence and transitioned from case management, direct Office of Mental Health case management. It really, the model is not designed for us to be financially sustainable in the model that we have. They would argue that we pay too much for our employees. I would argue that their reimbursement model is not sufficient enough to pay the people appropriately for the work that they're doing. And so in order to not have to take cuts in other parts of our department where if we don't do the work, no one else will do it. In this instance, Honey will have to contract with another agency to provide these services in Tompkins County. It made the most sense for us to make this reduction here. It will impact 7 employees. It's 10 positions, but 7 employees that are currently in position, and the county has committed to and achieved being able to provide a full-time position to all 7 of those employees somewhere else within the county government. So there will not be layoffs associated with it. So we spent a good bit of time talking about that program and that decision, as you can imagine. And that was the bulk of the agenda for their last meeting.
Great, thank you, Frank. Are there any questions for Frank? Okay, I do not see any hands. Is there any new business to come in front of our board today? Okay, no new business. Let's go ahead. We do have a resolution for us to talk about. And if I could have a mover for this resolution, it's Voorhees' request to waive sewage permit application fee, 974 Ridge Road, Town of Lansing. If I could have a mover for that, please, to get it on the floor. Moved by Ed, seconded by Sue. And Liz, Karen, can you tell us a little bit about this action here?
So this is a situation where they have a failed sewage system, and as Derek noted, they're having some difficult times financially, and so he is requesting to have the sewage system permit fee waived. That's the quick summary of the situation. We support this, given the situation, and want all resources to be put toward replacing the sewage system.
That's great. Thank you, Liz. Are there any questions from committee members?
So Liz, there was something in the letter that said he tried to fix it and didn't really do a good job. Is there evidence that they're trying to remediate the situation, or even that they'll be able to?
We're taking this one step at a time. So the first step is to get the sewage system permit application. If there's other difficulties in the future, we would deal with that at that time. Adriel, correct me if that's my assessment of the situation.
Yeah, that's correct. I mean, as you know, being that he's out of work, we have a few homeowners that occasionally try and repair their own system, and he took it on himself to do that and didn't really follow the permit protocols like we had outlined, being that he wasn't familiar with it and kind of did make a mess of things. And so he set himself back a little bit. So yeah, again, we'd rather just waive this permit fee so he could put money towards either renting the equipment he needs to have in order to reconstruct the system, or ideally hiring a professional contractor to do the system.
Thank you. Ed, do you have a question?
Yeah, it was more about the process. Is a new permit needed? Is that what's happening here? A new permit is needed when the system has failed, or does the permit need to be happening to fix the system, or is it only when the system is incapable of being fixed that it has to be replaced?
So there's some minor repairs that we do not issue a permit for, which may have been what he was working on initially. But when you have to replace, for most significant repairs, and when you have to replace a sewage system, you do need to get a permit from us, where we, do the design and identify what needs to be done to do it correctly.
And Derek, I would also add, you might want to contact Tompkins Community Action, as well as give 211 a call, because I know that they do have some funds that they were just granted, and those funds are being used to help people stay in their homes with some minor home repairs. So they might be able to offer some assistance. Are there any other questions here before we vote? Okay, I see none. All those in favor of providing the waiver, please raise your hand. Okay, that is unanimous. Thank you all. Derek, your waiver has been granted, and you will receive confirmation from the Environmental Health Department. Thank you, Liz, for your work on this. Okay, sorry, I'm navigating on a computer screen here and trying to go up and down the agenda. Next is there's a spot for administrative action, and we already established a nominating committee.
Donna, I got two names out of that. I got you and Christina. Did somebody else volunteer? Oh, Dr. Dundali. Okay, perfect.
Okay, is there any other business to come before the board?
The only thing that I would share, Shauna, is strategic planning has started up again, and so the representatives from the two boards have already had a meeting with the consultants. I believe the staff meeting between the two groups is this week, So that process is underway. One thing we wanted to make sure was clear to folks was that there's not an expectation that the plan is going to come to the boards for a final vote at the end, right? This is a strategic plan, is operational, has an operational component to it. We are asking for the board through your representatives to be advisory to the staff committee that is developing the plan. We're going to make every effort along the way to communicate to both boards about the process and what has been unfolding. So there will be an opportunity for you to weigh in there as well. And so we just want to make sure we set that expectation early, that we're not planning for a formal vote from the boards on the plan when we get it to its final draft. But we certainly want your input and feedback through the folks that are participating. And then also, if you hear something as we're reporting, we definitely want to know what you're thinking.
And can I add to that? Because I'm supposed to be on that committee, but the meetings are always during my clinic time, so I haven't been able to attend. So I'm wondering if another board member should replace me.
Okay. If there's anyone else interested, what I can do is have Shelley send the date and times out. I think we had some other folks that wanted to be backup if there was a chance, but I don't know when those meetings are scheduled. I think one is now the end of October and then one in early December. Let me get those dates and times and we'll send it out to the other board members, and we can see if somebody else is interested in stepping in, if that works.
Okay, thank
Great.
you all. If there are no other announcements, if I could get a mover to adjourn the meeting. Moved by Sue. If I could get a seconder, please. Seconded by Ravinder. And all those in favor to adjourn. That is unanimous. Thank you all. Boy, this is a record time, 39 minutes for a Board of Health.
Should make you president all the time, Shauna.
No. Thank you all. Have a great day.
Take
Thanks,
care,
everyone.
everyone. Bye-bye.